Our focus here at St. Paul's in our cardiac CT and pulmonary imaging department has been primarily focused in really three areas. The first is in supporting the transcatheter valve replacement program, particularly the minimally invasive structural heart disease team. So we're looking at ways to use CT to improve clinical outcomes, both for transcatheter aortic valve replacement and now transcatheter mitral valve replacement. We've also been looking at ways to bring out more information from a cardiac CT, providing more accurate diagnoses for the diagnosis of coronary artery disease.
Over the 7 years that I've known him, since 2007, he has been instrumental in producing a huge body of research that affects the way we look after patients day to day. When I looked at his accomplishments, I realized that he published in fields such as transapical valves, myocardial viability, use of MRI and CT scannings, all in the area where imaging brings answers to the questions which previously we did not have answers to.
I think that I'm motivated by the opportunity to learn, really, and to help patients. I think there's so many questions that are unanswered in medicine, and to be fortunate enough to work in an institution with so many bright people that are equally motivated to help patients and try and improve care wakes me up every morning excited to come in, to try and do better for the patients we serve, to try and help answer some questions that remain unanswered in the practice of medicine so that we can improve those clinical outcomes and help inform not just our colleagues here at this hospital, but the broader imaging community, both nationally and internationally, to try and reach out and provide information that improves the outcomes of patients beyond the confines of this hospital.
So not only is he a researcher, not only is he a collaborator, but he also deeply cares about quality, and he is now a chair of our medical advisory committee, chaired a council on clinical excellence.
To have been nominated by my colleagues in cardiology and by Dr. Ignaschewski in particular is tremendously important to me. I work extremely hard to support my clinical colleagues, the cardiologists, the respirologists, and the remainder of the colleagues I work for. And to know that I'm appreciated on that level is very special for me. I also am particularly honored to be sharing this award and to have Dr. Sin up there with me receiving the Mission and Research Award, to be mentioned in the same breath as Don with regards to research capabilities is obviously a bit overwhelming for me, because I have tremendous respect for him and his accomplishments, and he's actually served as a research mentor to me, so to be able to share in the honor with him is very special.
As a cardiologist who looks after many of patients affected by Jonathan's work, I am very pleased that I am now able to give them answers that will affect their care and often survival because of his research.